Thank you once again, Dr. Eduardo Gonzalez. That was a phenomenal overview of some of the responses that we've seen by the Mexican authorities, and also a true overview of the epidemiological challenges that we're seeing on the Mexican side of the border. My name is Dr. Talia Porteni. I am currently a postdoc at Tufts and a very proud alumni of the health policy PhD program here at Harvard, and truly focusing on migrant health, which is, I think, what drives us all to be here today. So it is my privilege to introduce our first panel today. We're going to talk about understanding the needs of the people that are on the Mexican side of the border, and truly hearing from voices that are on the field. To echo Stephanie's point, this is not an ivory tower discussion. We're here to learn, to hear, to understand what's happening on the other side, which is something that really very rarely, having lived in this country for a very long time and being Mexican, is it a sight that we hear in the news. And so first, it's truly an honor to introduce these wonderful speakers. Dr. Alejandro Olayo Mendez is an assistant professor at the Boston College School of Social Work. Dr. Alejandro Olayo Mendez has taken particular interest in the intersection of humanitarian aid and migration, as well as questions regarding human rights, inequality, transit migration, meso-level structures, and the so-called migration industry. He has collaborated with Jesuit refugee services by conducting interviews with internally displaced people in Colombia, in Tamil Nadu, India, in Chicago, Illinois, and in Washington State. He is currently preparing a project that on research that affects the migrant protection protocols on Mexican communities and humanitarian interventions. He has seen and lived many of the experiences of asylum seekers at the Mexico-U.S. border. And additionally, Dr. Alejandro Mendez is a Jesuit priest from the West Coast province in the United States. And we also have Adolfo Flores. He is the national security correspondent for immigration for BuzzFeed News. He covers stories related to immigration detention, asylum, and deportation, amongst other issues. Flores has traveled throughout Mexico with 2 caravans of immigrants and has spent months on the Mexican side of the border with immigrants and asylum seekers. He has witnessed the conditions of people sent back to Mexico as a result of the migrant protection protocols in Tijuana, Ciudad Juárez, and Matamoros. In recent months, Flores has spent time in Matamoros writing and speaking to health professionals about MPP returnees living in an encampment who use the Rio Grande to bathe and wash their clothes. Adolfo is a former reporter for the Los Angeles Times, where he covered breaking Los Angeles and California news. He's also reported for the Pasadena Sun and Pasadena Star News. As a Los Angeles native, Flores graduated from Cal Tech Northridge. And Julie Cashew works as an emergency room nurse at critical access level 4 trauma centers in Tucson, Arizona. She is a longtime volunteer for organizations serving migrants along the U.S.-Mexican border, including the Kino Border Initiative and Samaritans No More Deaths. Julie has recently worked to establish and support medical facilities and trainings for refugee communities in both Syria and Bangladesh. She has worked in the American Red Cross to coordinate services for families and victims of the September 11th attacks, and with medical solutions to support critical access hospitals in rural settings in Washington, Arizona, and New Mexico. Julie earned her MPH from Hunter College and studied nursing at the Clinical Nurse Leader program at the University of Maryland in Baltimore. And Father Javier Calvillo is the director of Casa del Migrante. He is a diocesan Catholic priest from the Diocese of Ciudad Juárez, Mexico. He earned degrees in philosophy and theology from the Diocesan Seminary of Ciudad Juárez and has been a priest for the past 15 years. After his ordination, he was named secretary of the Pastoral Commission for Migrants in Ciudad Juárez. He has been the director of Casa del Migrante de Ciudad Juárez for the past 9 years. In his role, he oversees the operations of the migrant shelter that offers humanitarian assistance to migrants, asylum seekers, refugees, and Mexican deportees. The shelter provides services such as food, shelter, communication, and medical assistance. He is a liaison to organizations such as IOM, UNHCR, Instituto Nacional de Migración, and Mexican authorities. He also supervises the collaboration with Mexican and American volunteer organizations that support and advocate for migrant populations. And last but certainly not least, this fantastic panel will be moderated by Professor Ieva Husionite. I hope I pronounced that well. Professor Ieva is an assistant professor of anthropology and social studies at Harvard University. Her research and teaching interests lie at the intersection of political, legal, and medical anthropology. Based on fieldwork in the tri-border area between Argentina, Brazil, and Paraguay from 2008 to 2004, her first book, Savage Frontier, Making News and Security on the Argentine Border, examines how local journalists both participate in and contest global national security discourses and practices in a region portrayed as the hub of drug and human trafficking, contraband, and money laundering. Her second research project focuses on security infrastructures and emergency services along the border between Sonora and Arizona. Her 2018 book, Threshold: Emergency Responses in the U.S. Border, delves into the lives of first responders under heightened security on both sides of the wall. Written from the perspective of Mexican and Mexican-American firefighters and paramedics, the book reveals what happened when politics and of wounding and ethics of rescue collide. Currently, she is conducting fieldwork for her latest project, Firepower, a multi-site ethnographic study that follows firearms as they move through the legal and political regimes that compete in gun violence shops and along the Texas and Texas and Arizona shooting ranges, as well as public disarmament campaigns around Mexico. Ieva also sits in the Mexico Faculty Committee at the David Rockefeller Center for Latin American Studies. Thank you.
Thank you very much for the opportunity to collaborate in this project from Boston College. We are very thankful for this opportunity. I'm going to go quickly over a couple of things that we have been doing. As you know, the migration patterns have been changing since the end of 2018. They have been, of course, migration patterns in Mexico have existed for more than 2 decades, 3 decades. That's not anything new. I think the caravans were in some way a combination, and it's very interesting here. I want to say migrants themselves call it éxodo migrante, migrant exodus. So in terms of positionality, I think that's a very interesting take. So nevertheless, there's this, I think that the caravans were a combination of opportunities and circumstances. There were just the possibility of protection from violence, paying high fees, and the collaboration of the people. They just took off, they organized themselves and said, well, we cannot cross, let's start walking. So that's what they did, and I think it's something that is very interesting. I think that at some point, because of the tweets from this side of the country, it gained a lot of media coverage, which in some way created an effect and created kind of like this perception of what was happening. The Mexican government approached the caravans and all the movements until the middle of this year. They approached it with contradictory practices. At the beginning, it was very friendly. It was based on the migration law, respect of human rights, and later on, it was kind of like this tension between control, migration control, and protection. As I said, the US government has labeled this movement of people as both a humanitarian crisis and a security crisis. Probably the emphasis has been on the latter, which has colored all the perceptions around the media. One of the things I think is important just to differentiate here, we have 2 waiting lines of people. So when we talk about the people at the border, we have 2 lines. One is the people that arrive off the border. Some of them arrive with the caravans, others arrive by themselves and by other means. Some people cross the border, and then they are catched by migration authorities in the US, and then they are returned. All these people are the people who enter under the MPP program. At the same time, there are some migrants who reach the border, and they do not cross, but they wait. So this creates 2 waiting lines of people at the border. I think it's necessary to emphasize that, yes, we have a large number of Central Americans, but at the same time, we have Cubans, we have Venezuelans, we have Haitians, we have some extracontinental migrants, Africans, people from India, Bangladesh. So it's this huge array of people that you can see at the different points of the border. You have Brazilians, and of course, recently you have an influx of migrants being affected by the violence in Mexico. Along, of course, you have to consider here the deportations from Mexico, from the U.S. back to Mexico of Mexicans, but at the same time, those Mexicans who return under the label of voluntary return, that they don't enter the statistics of deportation, but still they are received at the border. So this is from the New York Times. I think it's a very interesting line. Let me see. Yes, I have. Here you have the green lines. In the 4 cities, it's Tijuana, Mexicali, Juarez, Nuevo Laredo, and Matamoros. Those are 5 cities. Those are the people who officially return under the MPP. Now, just recently it was announced that Piedras Negras will start receiving people also from the MPP, and it was announced this week or last week, I think so. The blue lines are the people who arrive at the border, arrive at these other border cities across the border, and they are remaining there in the hope of waiting at some point to be heard by American authorities to file for a claim. So these numbers create, and these numbers continue to grow, are close to 60,000, probably over 60,000 people in different cities across the border. So I think this is very important to distinguish these 2 lines, because one will give us the official numbers that are on their MPP, but then you will have all these other people who create all these people waiting at the border. So as you know, the migration protocols is this policy that says that certain foreign individuals will be returned to wait for their asylum claims in Mexico. It's unclear what is the process or what is the determination to say who returns and who doesn't, how families are separated or not. There's a lot of clarity about those things. Mexico, and the rule says there that Mexico will be in charge of providing all the resources. MPP operates in Tijuana, Mexicali, Juarez, Piedras Negras, Nuevo Laredo, and Matamoros. So what are the challenges for this? And I have to go quickly. I conducted my fieldwork basically in Tijuana and Juarez. I think the model of reception of migrants is still a living thing. It's developing. The model for humanitarian assistance is a work in progress. My assessment is that there's no clear adequate model. Basically, migrants are returned, they are registered by migration authorities in Mexico, and they are transferred to either the federal shelter or to other shelters in the country, in the city. Here it's important to say the only pilot that is being run official, the federal government, is being run in Juarez. So that shelter right now holds 700 people. I think what is important to say is the rest of the work all over the border is run by private shelters. Basically, many of them are faith-based that continually have to adapt to the needs of the emerging needs of migrants. All the pictures that you see are from fieldwork and are for the places. I have to say that asylum seekers have multiple interviews with migrant authorities. One thing that is important is some of them will have the first interview. I interview people in June. Some of them will have the interview in January 2020 or April 2020. And that will be probably the first interview that they will have. I would say that migrants' shelters are not designed for long-term stays. And the Mexican government, even though he grants asylums, certain rights to asylum seekers, it still is a permit to work on the 180 days, and it's kind of like complicated because of the rules and regulations at each of the shelters. There is also at the border, there is a context of violence, which is also a risk and a hazard for. So this is a shelter in Tijuana. It's not official shelter, it's faith-based, but you see the people living in tents. They have been Haitians and Central Americans living in these conditions for probably 2 to 6 months there. So some considerations. So when we have shelters, because of the rules and the things that they have to consider, the policies, some shelters are closed, meaning migrants cannot go out. So what happens? Do we have detention centers light that control the population, that contains the population, or do we have a de facto refugee camps? in some way, the public health is a growing concern for the migrant population, but not only for the migrant population, but also for the community. When you have 30, 40,000 people, or even if it's 20,000 people at the city, a city that has probably less than 500,000 or 300,000 people, it's a hazard for the community. I think the biggest challenge is that people are not aware, they don't have access to information, they don't know exactly why they are in the MPP, they don't know what is happening, and they have a lot of issues of stress because of the uncertainty, and idleness. Idleness is a big issue. And I will say, just kind of like saying, well, waiting time, it seems to me that is being as a deterrence strategy, so people will just give up in the process. I would place the question of, is this really a security crisis or is really a humanitarian crisis that need to be addressed by all the actors involved as such? I think it's curious that in spite that this is kind of like, it's evident that there's a health hazard and there's a humanitarian crisis, the role of international actors is limited. So at Juarez, you only see IOM, kind of like just repatriating or trying to recruit people to move. So that's what I will say. There are no clear health prevention strategies, and as much as there are efforts, this model of attention for migrants at the shelters is still a work in progress with a lot of dangers for both the local population and the migrants. So thank you.
Hello. So for the last 3 months, I've been living in South Texas to report on MPP, the Migrant Protection Protocols. The reason I wanted to do it was because I really didn't see a lot of coverage from the Mexican side on this program, and I thought, why not just move there and do it? So yeah, the policy has sent back more than 55,000 people, I think you said it was 58,000 people, to different cities along the border. It started in Tijuana in January, and then Mexicali, Juarez, Matamoros, Nuevo Laredo, and last week, Piedras Negras officially started to receive people in smaller numbers, but that's the latest one. So Matamoros is where I spent most of my time as of late. And I mean, to me, like the most glaring health concern that I would have is the lack of clean water. The people living in an encampment near the Rio Grande, it's at about 2,700 people is the best estimate I could get. And it grows by the day. People get sent back all the time. It's women, it's adult men, it's children, and they use the river as to bathe, wash their clothes, and cool off. But it's also used as a restroom because there aren't enough porta potties and public restrooms that they can access. So the Rio Grande is the easiest way they can access water. The thing is, people come out days later and they'll have rashes, and they suspect it's probably from the river, as you'll see. But they don't really know what it is. They don't really have access to medical care, even though they are eligible for it, for state public health care. They'll go to, let's say, a hospital or a clinic, and sometimes it will say, oh, I get sent back, or they tell me to come back later. Or when they are seen, they feel like they're kind of rushed and just given antibiotics and sent on their way. So there's a nurse, she works with the Global Response Management. She just started showing up a month ago with this organization that brings in medical professionals. And I asked her, what are you seeing? She told me they've seen scabies, fungal rashes, difficult to treat infections, and respiratory issues. Infections like pink eye, for us, are, easily treatable. But in this camp, you are, you treat it and you're sent back to the same conditions that made you sick in the first place. So there's this little girl who got pink eye 3 times, back to back. And now she has corneal scarring, which could permanently, mess up her vision. Another example that was given was, fungal infections in the armpit. There was a baby that the infection was untreated for so long, it started to scar the armpit. So, this is like the main concern is it's not that these are like super diseases and that they're bringing, all these diseases to the border. It's stuff that we would deal with normally, but because of the conditions that they're in, it's hard to treat. Matamoros has one shelter with very limited bed space, and there's a time limit on how many days you can stay there. There are churches that are housing people, but it's very unofficial. And the city government gave the federal government the space last week to use as a shelter. But the issue is these people have been living in the encampment for 4 or 5 months now, with what they would say is very little help from the Mexican government. And so they're very distrustful. They don't want to leave that area and go deeper into Matamoros, which is very dangerous. And so that shelter now is filled with recent MPP returnees, not the people that have been at this camp, for months. And so it doesn't seem like there's going to be any change to the conditions that people are living in. The other thing, we honestly, I would say, reporters covering this, we haven't really focused on the health aspects as much, but even less so when it comes to mental health. But you talk to doctors who work with these children and in these families, and they'll tell you they have anxiety, they have PTSD, not just from the conditions that they're leaving their homes in, but from the journey sometimes. And once they get to the border, they are targets for kidnapping, and it's a concern that even if it doesn't happen, like violence, the kids are aware of it. It's something that they're very worried about. And there was this 8-year-old boy I met last week, and he saw the federal police truck roll by, and he started freaking out. And then the mom's like, "Oh, it's like because when we're coming up here, we were avoiding them. Like when he saw them, that meant like run and hide, But we're here." The mom was like, "We're here now. It's fine." So these are the things that these families are dealing with, and survival, food, avoiding violence, like that is very much a priority. Health, is not that immediately. It's not an immediate issue for them, but it's going to become an issue. I'm not a medical professional, so this is basically what I've seen in the last few months. And there are efforts, there are people who do reach out to them. In Matamoros, a lot of the help is coming from people in the U.S. who come over to provide legal aid, but also food. They just set up these mobile showers, but again, it's not enough for 2,700 people. Thank you very much.
I'll just show the one of the Commodore.
Yeah, it's not popping up.
Oh, that's okay.
Okay, so they're not popping up. Do you want to move without them?
Yeah, that's fine. They're not on.
Okay.
Yeah, it's fine. There's some pictures here of the area where I work. I'm Julie Cashew. I'm a nurse, an ER nurse in Tucson, Arizona, actually 50 miles southeast of Tucson right now, supporting critical access healthcare. My passion really started in public health, and refugee and migrant health. And I returned to Tucson about 10 years ago to continue that work from Baltimore, where I worked in HIV. So I'm really honored to be a part of this and to express my concerns and represent my fellow colleagues in Tucson who've supported this opportunity. So I've got some big shoes to fill as far as relaying all the stories that we've all experienced in working down at the border and the changes that we've seen throughout the last 10 years, 7 years. I work with Samaritans, No More Deaths, and Kino Border Initiative, it's an amazing organization just south of the border, where a kitchen is operated that provides basic necessities for the migrant population in the form of food, clothing, legal services, counseling. It's sort of a consortium of efforts from various organizations, and check cashing. Our little nook in the shelter, for some of you who've been there, operates also medical support, referrals to local organizations. And when I started working here, along with everyone else, we have definitely seen this movement from, as everyone else on the panel has suggested and seen personally, from 7 years ago when we were dealing with harm reduction, just basic triage of, say, a room of 50, 60 men, and kind of triaging them and asking what their basic needs are, harm reduction, do they have their, say, their ARVs, or if they are HIV positive, where they can go once they get to Tucson, or wherever they're going, and supplying them with those resources before crossing, making sure they have the supplies they need if they're crossing. Most of them at that point were going through the desert. So that was our job as medical personnel at that time. And that sort of transitioned into what we're seeing now, which is managing chronic diseases in the face of going and presenting for asylum. And then how will they then manage, while in detention or prison, basically. So once they present for asylum, and that case is going to be pending in the United States, a lot of them then we see on the other side in detention, where if they're dealing with hypertension, if they're dealing with HIV, or whatever their clinical condition might be, that hopefully that's being managed on the other side. And unfortunately, that's not been shown to be the case under the private. It's another whole discussion and panel, I'm sure, to deal with the privatization of these detention facilities. So what we see on our side of the border is that transition, where once we were setting bones and maybe giving temporary adjustments after they're deported to mostly men, 50 people at a meal. We're seeing 200, 300 people at each meal, different settings and very quickly. So the small organizations that are supporting these efforts are really, really strained in their resources. That's volunteer cooks in the kitchen, that's volunteer mental health counselors, that's volunteer nurses, doctors, and lay health workers that have been trained. My dear friend Bob, there's some pictures here, but he took some photos just to show the little shelter. It really is the size of, the kitchen is the size of this room, and 300 people through the course of one breakfast or dinner. You can imagine the resources that are pulled to put that together. It's really incredible. And that's not to discuss what's going on in the outside with the shelters in Nogales. I'm speaking to Nogales. Soon Kino will be moving their operations to a larger facility where we'll have more room to discuss mental health in private, prenatal checks, assessing imminent deliveries of babies, which we're seeing now, and a lot of people haven't had to deal with that on the clinical level. So figuring out ways to train other healthcare workers on how to do this. It's a massive undertaking and a massive opportunity to train and teach people sort of on a promontora level to using the skilled labor force and doctors and nurses to go ahead and promote those teachings. I'll just save the rest for questions on the panel, but it's really an honor to be here, and I'm so happy this is happening. And again, my friends at Kino or my friends at Samaritans and No More Deaths, it really is an open invitation to come down and see the work that's going, and you'll have a place to stay. And and my email is yours if you want it to make that happen. Thank you.
Buenas tardes a todos. Hay que reconocer que México va cambiando. México ahora es.
We have to realize that Mexico is changing.
México se ha convertido en un país de expulsión, de recepción, de tránsito y ahora de desplazados.
Mexico has become a country of expelled people, of displaced people, and migrants as well.
Es interesante ver en el 2016 la visita del Papa Francisco.
It's interesting to recall the visit by Pope Francis in 2016.
Tocó 5 temas,
He touched on 5 subjects.
entre ellos la migración.
One of those topics was migration.
Abajo de la filmina aparecen 3 escudos.
You can see 3 images here at the bottom of this slide.
Es con lo que tratamos de responder a estos retos.
These represent our attempt to respond to these challenges.
Unidos a la diócesis, derechos humanos
Together with the dioceses, human rights,
y la Casa del Migrante, que tiene 36 años.
and the House for Migrants, which is 36 years old.
¿Cómo inicia todo este proceso o todo este cambio?
How did all this process or this change begin?
Hay que reconocer que estamos en la frontera entre el estado de Texas y Chihuahua.
We are on the border between the state of Texas and Chihuahua.
Estamos entre El Paso, Texas y Ciudad Juárez.
We are between El Paso, Texas and Ciudad Juárez.
Todo empieza en septiembre del 2018
It all began in September 2018
con las caravanas centroamericanos, cubanos, haitianos, brasileños,
It began with the caravans of Central Americans, Cubans, Haitians, others,
africanos, venezolanos, gente de Europa y gente de Oriente.
Brazilians, Africans, Venezuelans, people from Europe, and people from Asia.
Uno de los retos que hoy estamos viviendo es el retorno que está haciendo Estados Unidos a México.
One of the challenges we're facing today is the return of migrants
Por toda la condición en la que están siendo recibidos o tratados.
because of the conditions in which they are received in the United States and treated before they are deported again.
Cuartos fríos, separados de sus padres,
Cold rooms, separated from parents,
o bien en algunos espacios libres,
or in some free spaces,
o en algunos lugares que parecen gallineros donde se pudiera tener animales.
or in some places that rather resemble chicken coops where animals might be kept.
Definitivamente una violación a sus derechos humanos y a su dignidad.
This is a clear violation of their human rights and their dignity.
Otro de los retos interesantes es la presencia del gobierno federal.
Another interesting challenge is the presence of the federal government.
Ante toda esta realidad que se está viviendo, manda a la Guardia Nacional para que haga presencia en el muro y en todo el estado de Chihuahua.
Viewing all the situation, they sent the National Guard to the border and to the state of Chihuahua.
Incluso ahorita tenemos como delegado de migración un comandante militar y un
Yep.
subdelegado de migración, también un militar.
And we also have a military commander who is there in charge of migration, and there's another military person who is his assistant.
Una de las cosas que hoy ahorita está pasando son los mexicanos que ahora se están desplazando del sur, del centro y algo del norte.
Another thing that we're seeing now is Mexicans that are moving from south, the center, and the north.
Ahorita en el puente Santa Fe, puente Zaragoza, puente Libre, hay entre 3,000 y 4,000 mexicanos esperando asilo político.
Right
En-
now, in the bridges, Santa Fe, Zaragoza, and others, there are, ¿cuántos? 3,000?
Zaragoza, puente Libre y puente Santa Fe.
And Puente Libre.
Como desplazados, pero ya pidiendo asilo político.
We have had 3,000 to 4,000 people who are displaced, but now they're asking for political asylum.
Viviendo al aire libre, tienen ya casi 3 meses y todavía no hay respuesta de ambos países, de México y Estados Unidos.
They're living outside, and they still have no answer from either of the governments, Mexico or the United States.
Pudiéramos preguntarnos aquí si algo se hace por los extranjeros.
We
¿Qué
might
se,
well ask if anything is being done for foreigners.
qué se hará ahora por los mexicanos todavía esperando?
And what about the Mexicans who are still waiting?
Definitivamente uno de los retos más fuertes es la salud en todos los aspectos, la médica, la mental, la emocional.
One of the greatest challenges, no doubt, is health in different aspects, medical, emotional, psychological.
Es complicado en un albergue tener población de niños, embarazadas, mujeres y hombres.
It's difficult in one single shelter to have a population of women, pregnant women, children, and men.
Gente, mujeres que han sido violadas, embarazadas y quieren abortar.
Women who have been raped, who are pregnant and wish to abort.
Gente que ha sido secuestrada, que ha sido mutilada o bien por la trata de personas.
People who have been kidnapped, who have been mutilated, or who have been victims of human trafficking.
Gente que ha pasado por 7 fronteras para llegar a Ciudad Juárez.
People who have gone through 7 borders to finally reach Ciudad Juárez.
Gente que llega con SIDA, que llega con las plagas de piojos y chinchis y todo eso contagiar a los albergues.
People who arrive with AIDS, people who arrive with things like lice and others, and what they do is create contagion for other people who are at the shelter.
¿Qué hacer cuando el albergue es para 600 personas y hay que aceptar o tener hasta 1,200 o 1,300?
What do you do when you have a shelter for 600 people and you have to accept as many as 1,200 or 1,300?
Hablemos de la población también vulnerable, LGBT, transgénero, gay, toda esa gente que viene o todos esos hermanos que vienen con toda esa realidad.
Let's also talk about the vulnerable populations, LGBT, people who come with that additional vulnerability.
Creo que de veras una de las cosas que tiene que hemos dado respuesta es si la sociedad, algunas organizaciones civiles y tarde, pero han llegado algunos refuerzos del esfuerzo federal, estatal y municipal.
The response has been on the part of the society, some civil organizations, and late, but at least it arrived, some help from the federal and local and regional authorities.
Definitivamente uno de los retos sí es la salud, pero más que nada es lo que la sociedad piensa, opina o dice. El migrante no es un mal, el migrante es una persona.
One final challenge is, of course, health is a great challenge, but also what does society think about migration? Migration is not an evil. A migrant is a person.
Quisiera terminar sobre todo este compartir con 3 frases que a mí me ayudan.
I should like to close with 3 phrases that have always been helpful to me.
El día de ayer venía viendo un comunicado que saca un representante de la ONU
Yesterday, I was looking at a communique from a representative of the United Nations.
y dice, la mejor solución que podemos dar a esta enfermedad actual
He said the best solution we can provide for this problem, this disease,
es la justicia social.
is social justice.
Mientras haya discriminación, mientras haya pobreza y mientras no haya igualdad, no se va a poder solucionar este problema.
This problem will not be solved as long as there is discrimination, poverty, and no equality.
La migración es cuestión social, no solo de una persona o un grupo nomás.
Migration is not about one person or one group, it is about society.
Otra frase que me encanta, todos somos migrantes.
Another sentence that I love, we are all migrants.
Mira tu historia, mira tu pasado.
Look at your own history, look at your own past.
Vas a descubrir allí que alguien de tu pasado pudo emigrar. Ahí está la semilla de migración.
And you will discover that somebody in your past was able to migrate, and there is the seed of migration.
Otra es, no solo se trata de migrantes, sino se trata de toda la humanidad.
Another one is, it's not just about migrants, it's about all humanity.
Si no se respeta al migrante, no se está respetando a toda la humanidad. Por eso no puede decir la humanidad o la sociedad que no se puede acoger a los migrantes.
If a migrant is not respected, then all humanity is not respected. That is why society cannot say that a migrant will not be accepted.
Gracias.
Thank you.
Thank you for all the panelists and for the keynote speaker. I do have a few questions maybe to start off the conversation, but then I will open the floor for questions from all of you. From the presentation of Dr. Gonzalez, the keynote talk, I got this almost I was almost optimistic after I heard it. I thought, okay, there is a scheme, although it's very complex, but there are avenues that migrants and asylum seekers and local responders, healthcare providers who are on the front lines can turn to deal with most pressing healthcare issues, both physical health and mental health. However, after hearing from the four guests from the front lines, it seems that the situation is much more complicated than it can appear, and it's also different among the different towns, perhaps. So my first. Well, I definitely agree with Father Carrillo that a lot of the issues, a lot of the problems that we heard about today have to do more with much more broader systematic problems of social inequality and injustice that cannot be so easily addressed. But thinking a little bit more narrowly within the field of public health, it seems that although a lot of volunteer organizations and shelters have been dealing with migration crisis for quite some years now, several decades, the situation has changed and responders on the front lines are overwhelmed. So the question would be, why is it not working? What is the most what are the most urgent concerns that could be addressed either by different levels of the U.S. Mexican government as well as the U.S. government? Who has the responsibility to deal with the situation? How much is it Mexican responsibility? How much is it United States responsibility again? And how much can really volunteer responders do without resources from more robust resources committed from different state institutions? So I will just ask any of you for comments on what would you suggest is the most urgent thing that could be done, and who should take responsibility for that?
Okay. I think the policy is clear. Mexico will provide services to this population while they wait. I think the way to go, if I may have a suggestion, we need to think of a collaborative model. I mean, like, okay, you want to send people back, fine. But you cannot, I don't think you cannot overwhelm border cities within this larger context just to provide services. I think that in some way what is happening, the shelters in all cities, who are from different sizes, capacities, and abilities, they cope. The coping is reaching kind of like a certain level. And at least the concern that I have is that this is a situation that there are people waiting in Mexico are there for the long haul. I mean, they are going to be waiting for 6, 7, 8 months. And I don't think there's a clear model that can respond, or at least it hasn't been developed, to serve the needs of the people and the communities there, because I think it's this much more systemic issue. There hasn't been the model developed to tend to those needs. So,
Yeah.
but
I agree. I mean, when the chickenpox outbreak happened, I mean, which continued for about 6 months, we're dealing with late-stage effects of this. And families that were forced to wait 6 months or outside, and the children are now presenting with high fever and respiratory illness, then where are they going to go? They're going to go to the hospital in Nogales, which was already overwhelmed. So, you know, as a bunch of volunteer nurses coming 2 days a week, and a medic here, and at this time we didn't have a lot of volunteers. Maybe we didn't have any doctors going down. But even then, we'd call, you know, the husband of one of the kitchen volunteers, and they would direct us on where to go. It was just a network of local resources. That's what it was, in my opinion, or my observation. Just this incredible network of local. But how long can that sustain, right? It's not sustainable. And that permeable membrane that is our border we have to take responsibility on how we manage this waiting period and the resources. Well, teams of collaborative CDC workers going down to manage and track the disease process that's going on. It can save lives. I don't even know how many people died or were hospitalized from that particular childhood illness. And I know I sent several to the hospital from the shelter. You know, you eat breakfast and you come to this, the picture you can see then was just a wall of medication donated, and stuff we would bring, you know, on our own, hundreds of dollars, just ibuprofen, Tylenol, managing the symptoms and getting them back to the shelter where the chickenpox is spreading like wildfire. But it's not our fault for sending them back. Those people are just waiting at the border, you know, they're just waiting. But the same transmission idea is happening when we just send people down, and they're irresponsibly discharged from hospitals with information in English, failed attempts to educate our local emergency room staff that you can't discharge a patient who only speaks Spanish with English discharge instructions on how to manage a complex fracture, you know. This is not responsible, and this is our fault on this side, you know, and then it's up to the Nogales or Juarez to treat the patient in the aftermath. Well, who's the doctor? What antibiotics did they put you on? They didn't get you you know, and a couple of kind instances where Border Patrol paid for them to get the antibiotics, they were discharged. There were stories like this I've heard before, just kind agents who, on the way to the border, got them the antibiotics, and then these were rare, but I've seen it happen. I've heard this story, but anyway. So I guess that kind of collaboration has to occur.
yeah,
Otherwise,
we need to be creative about it.
yeah.
Sí, creo que ahorita tenemos ejemplos muy claros. Está Ecuador, está Chile, ahorita que están en crisis.
Yes, I think we have very clear examples now. We have Ecuador and Chile, which are in crisis.
Tenemos ahorita a Guatemala, que acaba de decir que no puede recibir a su gente, que no está preparado.
We have Guatemala now that just said we can't receive your people, but they're prepared.
Que cierra sus puertas, las embajadas, el consulado, no hemos podido regresar a la gente para allá.
They close their doors, their consulate, and we can't return people there.
Vemos a Turquía atacando algunas partes de Oriente, destruyendo, matando gente.
We see Syria attacking some areas,
Yo creo-
destroying and killing people.
En esto creo que todos debemos de participar,
I think we all have to be involved in this.
pero aclarando quien debe hacer cabeza es los gobiernos,
But
con
clar-
políticas.
Clarifying that this has to be spearheaded by the governments with their policies.
Y la sociedad acercarse a ellos, unirse,
And
Para-
society must reach out to them, join them,
trabajar juntos para poder salir adelante en estas cosas.
and work together so that things can work.
Por ejemplo, con nosotros está Cruz Roja Internacional, pero no siempre está.
For example, we have the International Red Cross with us, but they're not always there.
Tenemos médicos que nos puso el municipio, pero no siempre están.
We have physicians provided by the city, but they're not always there.
Estamos trabajando las 24 horas, los 7 días de la semana.
We work 24/7.
¿Qué pasa cuando un niño se me está ahogando o bronquitis?
What happens when a child is suffocating or when he has bronchitis?
¿Qué pasa cuando una mujer le va a dar un infarto o va a dar a luz?
What happens when a woman is about to give birth or when she's about to have a stroke?
Al momento de ir a los hospitales, no todos nos quieren recibir o no todos quieren recibir a los migrantes.
You go to the hospitals and not everybody wants to take these people in. Not everybody wants to take migrants in.
¿Qué hemos hecho o qué proponemos? Anunciar a la sociedad, promover a voluntarios para que médicos o pediatras o ginecólogos, cirujanos o algo voluntarios puedan ayudarnos. Creo yo que eso pudiera ser una propuesta.
What have we done or what have we proposed? I think one proposal should be to create awareness in the community so that we can have volunteers, volunteer physicians, volunteer obstetricians, all kinds of physicians. And I think that this could work.
Okay, thank you. So I do have a lot of questions, but maybe I'll open it to the audience because I'm sure you do too. Please.
Ricardo Cortés, I'm a graduate of the Ricardo Cortés, graduate of the Instituto Politécnico Nacional in Mexico. My question is regarding what you call the MPP. First of all, this is not a protection for immigrants. It's a name that the U.S. is using to portray something which is not real. A recent conference that I attended with Jonathan Ryan from Raíces, he said that was basically there's two prongs that they do and the U.S. government is doing is, first of all, we don't see any more images of people shown in the U.S. of immigration or immigrants being separated or immigrants being in prisons because they keep it outside the U.S. And secondly, the Mexican government is now taking these immigrants and send them into Tapachula, so they will never going to be able to go to their to assist to the cases they're going to be called for. And so the U.S. government now have basically ways of saying to the American public, listen, they're not coming for asylum, they don't show up, so this is working. So I want you to see what is your opinion on that.
Well, I mean, one thing I always say about the Remain in Mexico policy is a lot of its success, the ability for it to expand the way that it did, it was because people in the U.S. really didn't see it. Like, they don't see the stuff that we see on the ground. And, you know, when family separations were happening on this side of the border, and everyone was losing their minds, right? Everyone was upset. And then when we saw the conditions that kids were held in this summer, same thing. But now, because it's on the Mexican side, in cities that no one wants to go to, like no one wants to go to Matamoros because it's so unsafe, you don't get that constant stream of images and reporting, and if, you know, unless people keep seeing it over and over, it's not something they're going to think about and do. Like, I mean, what they should do about this program is above my pay grade, but I do think that part of the reason it's been able to expand is because of that, is because there is not a lot of attention to it, it is a little technical, right? And people, it's very easy to understand family separations and bad conditions and poor medical care, whereas this is just the asylum system, like I'm still learning every day. And so it's very complicated to explain to people what is happening and how it happens, because most of the time, we don't know. The immigrants don't know why they're put in this program. They don't know. The lack of information is also something that hurts immigrants. They don't know what they have access to, and they don't know what they should do. And that makes them make uninformed decisions, which is never good for anyone.
Before I take another question, maybe you can comment on the reactions of local communities, of residents of these border towns, where these migrants and asylum seekers are now being stranded. How have they changed from maybe being more welcoming to being somewhat more critical and giving more pushback? When there was news a few weeks ago about opening a new shelter, I think, in Mexicali, that local residents protested against that. It's nothing really different in Mexico. In the US, we have the same when we have big numbers of migrants competing for resources. Especially when it comes to healthcare and limited resources, what have been the reactions of local residents in northern Mexico, in Matamoros, in Juarez, in Nogales, elsewhere?
Well, it's funny. Like when I traveled with a caravan in last spring, the Mexicans were very welcoming and very helpful, and no one was upset. There was not this sense that we're getting now. But now in Matamoros, locals are upset, and they say these things to them that are, sometimes they even threaten them. And so it is very interesting, how quickly that changed. And I think it is because of the numbers and that they see, and they see them as competing for a scarce number of resources. Whether that's true or not, that's a perception. And yeah, it is. They're not getting the best reception, the welcoming reception in the cities that they're stuck in at the border.
Probably, I will say, a lot of the shelters, or many of the shelters, I will say, have emerged from local initiatives. So they evolved from these local initiatives, this care of the people. They organize themselves, and they truly, I do believe that they become a type of humanitarianism from below, humanitarianism that emerges from the ground. And so you have that side of the community that organizes, especially women. I think women are phenomenal about that. They are probably the most sensible and the first responders. So in a lot of shelters, you will see many volunteers who are women and who are very committed. But you will see, so the shelter, that's one side of the community that responds to the needs of the migrants. I think at the same time, probably it wasn't as visible as before, but I will say at the same time, you have other factions in all the places, not only at the border, but also in the communities where there's a migrant shelter, that have probably the opposite reaction, or either prey on the migrants and they see migrants as an opportunity to make some money, to sell some products or they believe at the border because they are easy prey for kidnapping or some sort of. So you have these, like any society, the divisions start to show up, and when you start to fight for resources or some local people feel neglected because they have been in some ways by society, by the government, then of course you start to compare why do they have all these resources available and we don't, or why they have they receive all the support when probably the conditions of many people in these border towns are pretty similar.
Yeah, it worries me that the creation of a more vulnerable population. That the longer people are there sitting, the kids aren't going to school. Everyone's doing the best they can to support these families, and the longer you go, you need more specialists and you need to recruit, whereas we could manage some of these organizations with lay health workers. As the pregnancy goes on, you now need someone to help deliver the baby, right? And someone to manage their chronic disease more acutely or whatever condition. There was a Syrian friend who, their brother, before I left Syria, they said, I was working in a camp, Al-Hol, which was predominantly, the fellow said to me, said his daughter has cystic fibrosis, and said to me, "Why you're taking care of all these children of terrorists, and you can't even help my child survive another month." That was one of the final conversations I had there, and it just struck me when I came home and started working. Again, it was some of the same conversations, like, it just repeats itself. It's the border. It's at a critical level, in my opinion, maybe middle age or I don't know what, just thinking that these solutions have to sort of go beyond that, conversations at work. I have friends who are of Mexican origin who are very anti-immigration more often than not. So we have these conversations where they're tired of supporting the migrant population in the United States and want to see them. These are other nurses. So opening up that conversation has become a bit isolating. You realize like, oh, this is just one person or one nurse, but it's not just one nurse or one physician. Just get them out of here and get them back down to the border. Give them the discharge instructions. Well, they can't read and they can't read English. These are the kind of repetitive situations that we could actually do something about on a binational level, I think. Like that's actually like a ray of hope that some of these organizations could work more collaboratively together on a clinical level, optimistically speaking.
Claro. Sí, totalmente de acuerdo.
Yes, I totally agree.
Creo que los mexicanos somos acogedores, somos
I think that
respetuosos,
are respectful and welcoming.
pero también depende de las fronteras o de las situaciones.
But this depends on the border and the situation.
No es lo mismo Tamaulipas, que secuestran, que ejecutan, que se provoca más la violencia,
Tamaulipas is one thing when there's kidnapping, where there's executions, where there's more inciting violence.
que por ejemplo Hermosillo o
And Hermosillo is
Tijuana,
very different. Or
más,
Tijuana.
¿verdad? O Nuevo Laredo, Piedras Negras o Juárez.
Or Nuevo Laredo, Piedras Negras, or Juárez are different.
Pero en la experiencia de Juárez hay gente de todo tipo de población como frontera.
But in the Juárez experience, there are people in all conditions.
Incluso nuestro albergue es sostenido por la comunidad, por los empresarios, por las organizaciones o por la misma comunidad del Paso, de las Cruces o de Ciudad Juárez.
Our shelter, for example, is supported by local community, by organizations from El Paso and Ciudad Juárez, and from several entities.
Siempre ha estado así, entonces creo que definitivamente Juárez sí ha afectado ahorita los cierres de los puentes.
It has always had this kind of support, but now Juárez has been affected by the closing of the bridges.
El cruce de los tráiler que lleva la mercancía, las exportaciones.
The crossing of trailers that take exports, merchandise.
La gente que va a estudiar al Paso.
People who go to study in El Paso.
La gente que depende del comercio de El Paso.
People who depend on trade with El Paso.
Los tiempos largos de cruces.
The long waiting times to cross.
Y todo lo que implica la trata de personas, toda esa inseguridad, claro que sí afecta a la comunidad.
And that whole issue of trafficking in people and insecurity, this affects the entire community. Of course it has to.
Y ahí algunos mexicanos se nos olvida los hospitalarios o la caridad.
And some Mexicans will forget hospitality and charity.
Y viene pues los comentarios negativos.
And then you have these negative comments.
Thank you. It's really not, not either or. All the people deserve resources and access to healthcare, right? So sometimes even maybe the way we pose questions or the media coverage pits one group of people against another, and it shouldn't be that way. But we have time for maybe more questions, please.
you. Okay. I'm Sharon Byron. Apologize for late entry here, but I had the opportunity to go to Argentina this past February, and Argentina, northern Argentina, from Buenos Aires to Salta to Iguazu Falls, that little triangle out there, was originally populated by the Jesuits when they built their little, the various little colonies around there. So I had a chance to see that firsthand. I had a chance to see some of the universities there. I didn't see language as an issue because a lot of the students there were with Google phones, and if I don't understand you, I just type I learned French, I learned German, I did not learn Spanish, but we were able to enjoy our whole trip there just because we could Google that particular language. I feel that a lot of these people are not being properly, we're not going to the source. If we give the children measles inoculations at the beginning, or chicken pox or whatever, as American children are, then we're not going to have the disease. But if we're just putting people in truckloads to be moving around, these are people that are going to be unwanted everywhere, and they're just bringing in disease. And with global warming, which is the hugest issue, these diseases are migrating north as well.
Okay.
And what I'm saying is I think we need to start looking more at how can we help these I understand if people are flooded out, but we have issues here in the United States where people are depressed, and I want to bring to your attention the recent artificial intelligence.
Yes, the question, please, because we
no,
only
no,
have
no. The
5
question
minutes
is, how do
left.
we get to the root cause? Because the impact of artificial intelligence and technology that you see, that I saw all over my trips. So
Okay,
our
thank you.
corporations.
I think we got your question. Does anyone want to take
So
it?
how can we get to the source instead of trying to fix the end?
Well, I will say we need to look at things much more systemically. On the one hand, you have the need there, the emergency. And I think it's part of our responsibility as a society to respond to the need. We cannot just kind of like turn the blind eye to that. And then at the same time, that's why the insistence in some way in collaboration or something, then we need to start thinking, how can we collaborate to provide solutions at a much more systemic level, a much more structural level, to address these type of issues, these type of emergencies. But I think we need to navigate that delicate dance of doing both. We have to address the immediate need, which is the emergency that you have in front of you, and we have to keep working and imagining how to collaborate to affect and change the structure so the responses, the legal structures, and the way we manage this legally or at policy level addresses more the issue. So it's both.
Okay.
Sí, creo que como estos ejemplos, los plenarios, los congresos, unirnos a iniciativas para poder llegar más a la sociedad, más a la humanidad.
I think that forums like this have to be a part of initiatives to reach out to society.
Y cambiar la mentalidad, cambiar un poquito el corazón y hacer ver que también ellos son personas, tienen dignidad como tú y como yo. Yo creo que estos espacios, aprovechar todo para que se pueda conocer más y valorar más.
And I think we have to reach out to create awareness that these people are human beings, and we have to create that desire and that ability to help more.
Thank you. More questions? Yeah.
Thank you all so much. My name is Claire Maxwell. I'm a public educator at the Immigrant Learning Center in Malden. And I'm curious, all of you have mentioned a theme of disinformation, an inability to organize well in the face of a lot of confusion, and the inability to get to communicate information about the crisis accurately to the public. But I assume that both because there is a lot of grassroots level organizing that, again, most of you have alluded to, and also quite a bit of organizing within immigrant groups themselves who are forming caravans, that there must also be some very successful new forms of communication that are happening throughout the situation. And I'm wondering if any of you can comment on, perhaps less conventional forms of communication or information sharing that are happening.
Well, I mean, this is probably not a example that will apply to everyone, but at least what I've seen, like when I see, like months ago, I saw a lot of Cubans arrive to a port of entry. It's Ciudad Alemán, and I was like, you know, how'd you end up here? It's like, oh, we're on this WhatsApp group, and we're just my cousin got here, and then he told someone, and so everyone's kind of sharing information through WhatsApp and also social media, which I mean I think is problematic because the situation changes all the time, and there's a lot of misinformation that goes into it. I honestly spend half my time when I'm interviewing people also trying to explain oh no, this is how the asylum process works. We're not seeing caravans anymore. The Mexican government has basically stopped that phenomenon from happening, and so that was a group that was able to communicate together. But I don't know, I could not tell you what a good way to communicate, but it is something that's important.
Yeah, I don't know either. I'm always amazed with how it happens. I mean, I think with disease presentation, or sadly, I think it's from the emergence of certain situations that promote a new support system. And then the need for the women and children, well, there's a need for, it went from overnight women joining, 2 or 3 women seating to 70 to 100 women to 300 women, and almost half of them pregnant with needs of prenatal care, to someone supporting that effort, and more local doctors, and then the women's shelter in Nogales, at least. That community rallied around. I've been impressed with the Jesuit community there, with all of the work of Kino making that happen, knowing that, well, now the medical has overrun the kitchen, so people are waiting, and mostly just to talk to someone. So we need someone that's more focused here, but we struggle with that in the United States. Our biggest problem in the emergency room is dealing with mental health issues, so it's the same issue there. But the informal networks, I don't know how it's happening or how to improve it, but miraculously, it's inspired a lot of wonderful change. I can't believe I'm speaking so optimistically, because I'm not an optimist by nature, and it is grim. I sleep for 3 hours when I come home from Nogales, or days when I come home from a trip, but when you present it in a forum like this, there is some more optimism that comes to fruition, I think. And the Border Patrol, not Border Patrol, Borstar, I think you know this, that if you've worked with the medics on the other side, I went to a collaborative conference of the medics on the border, and the representative from Mexico begging and pleading for help from the United States for more training for their medic teams. I mean, they're asking for help. Begging, literally, like he was saying, you come down and you talk to our medics just about transport and IV placement and pediatric fluid interventions. So the desire to learn and collaborate on that side is there. It's just now, how do we get that support to the people that want it to go to the source, because that's where it is. But now what? It would require some efforts there.
Sí, yo creo que la migración es un tema que siempre muy complejo, que siempre nos va a rebasar.
Yes, I think that migration is a very complex subject that will always be overwhelming us.
Detrás de la migración hay polleros, hay tratantes que traen todos los medios y toda una red.
Behind migration, there's also the people who traffic, who have a whole network to themselves.
De hecho, en México, primero, está todo el narcotráfico, y el segundo es todo lo de la migración que inyecta la economía.
In Mexico, we have drug trafficking, and we have all the money that is injected into the economy.
Nosotros siempre hemos dicho esto. ¿Quieres que algo se sepa? Coméntaselo a un migrante.
We've always said this, though. If you want something to be known, tell it to a migrant.
Es increíble que pueda venir una persona indígena que habla un dialecto
It's incredible that you can have an indigenous person who speaks a dialect come
pero trae su celular.
with a cell phone.
En el albergue salen 100 en la mañana y a las 3 horas ya me llegan otros 100 en un camión.
At the shelter, 100 people leave in the morning, and in the afternoon, another 100 come in a truck.
Y les pregunto o les digo, no tengo lugar.
And I tell them there's no room.
Ellos sacan sacan su celular y me dicen, se fueron 100 a las 10:15 de la mañana y nos mandó decir mi primo, mi tío, mi hermano, mi amigo, que aquí hay 100 lugares disponibles. Tiene que dejarnos entrar, si no, le echamos los medios de comunicación.
They pull out their cell phone and they say, well, 100 people left here at 10:15 this morning, and my brother, uncle, cousin, friend told me that there's 100 spaces here. So you have to let us in, and if not, you'll have to deal with the media.
Okay, thank you very much to the panelists. It seems where there is a lot of suffering, there's also hope. And we need to think about this problem really as a connection between the US and Mexico. It's not an isolated phenomenon that we can just isolate on the southern end of the side of the border. But I think we have to take a break before you're back here for the next panel. So thank you very much. This one.
Yes, thank you. We're going to take a 10-minute break, so we'll reconvene for our second panel at 2:30, so 10 minutes from now, if that's the exact time.
Yeah, that's sort of strange.